Excellent. This program is sponsored by the Autism Alliance. Before I introduce tonight's speaker, I would like to introduce myself. My name is Allison Daigle, and I'm one of the co-directors, joined by my colleague Pam McKillop, co-director. We would like to thank you all for joining us, and we do encourage you to ask questions throughout tonight's presentation. We are thrilled to welcome Dr. Andrew Fraiser, who will be presenting tonight on special needs dental care. Dr. Fraiser will be talking about Bubble Dentistry and their mission to provide calming, customized, and state-of-the-art dental experience for children. Bubble Dentistry understands the challenges parents of special needs children face when looking for a dentist. Their pediodontists have over 2 years of special training and working with children with developmental disabilities. This workshop is scheduled from 6:30 to 7:30, give or take a little bit. And with that being said, I'm turning it over now to Dr. Fraiser.
Hey, everyone, how are you? Yeah, so I just wanted to briefly start. So I'm an orthodontist. I practice over at Bubble Children's Dentistry and Orthodontics over in Newton, Mass, in Newton Center. We have tried to really recreate the whole entire experience for children there. Our founder, Dr. Barrick, she's super passionate about helping the autism community. And with that in mind, she wanted to create this environment for children that was really just a completely different experience for dentistry, all children. Just super calming from when you step in, it's all aquatic themed. So, you know, she had this great idea to make it basically like you're walking in Atlantis into the aquarium. So from the first second you get in there, you're walking through the tunnel, you see all the playful fish around, see a 20-foot humpback whale toy that's hanging on the ceiling. And from when you're greeted in there, you see all the live jellyfish tanks and all the live coral reef tanks. So
E a federação entre eu dar essa notícia para ela.
I'm gonna just mute that.
There we go.
Dr. Fraiser.
Sorry. So yeah, just everything about the environment is really calming and soothing for the children. It's an open bay concept too, so everyone gets to experience it. They can hang out at the live jellyfish tank, or they can go see the live coral reef tanks, see all the fish. But really from just that perspective, we just trying to have a different environment. So besides that, we wanted to think about how to approach dentistry differently. So not only is it a calming environment, but how we intake patients, how we speak to patients is completely different too. So we have very in-depth, medical history forms. We have questionnaires ahead of time. If you indicate your child is on the spectrum, we have a whole new list of questionnaires that's digitally, created for you with just certain questions and preferences. And we try to customize those visits for your child. Do you want, dark sunglasses? Would your child like noise canceling headphones? Would they like to be in a quiet room? Push toys, anything. And that's all ahead of time. And our staff is trained to really speak about that, talk to children, talk to the parents about that, and just do everything to make it a comfortable environment as well. I can speak about our pedodontists. I'll go into that in a second, just about some of the amazing experiences we've had working with children on the spectrum in the last 2 months we've been open. But from at least from the orthodontic standpoint, we've also tried to just rewrite the game and offer these children the latest and most digital in dentistry. Braces wise, we've worked really close with 3M to come up with a custom digital bracket system. So instead of a child having to sit for almost an hour and a half, 2 hours, that brace is put on, it's at roughly about 20 to 30 minutes. So they can come in, get them placed, and that's that. I'm more excited though about the Invisalign process. I think pretty much all children should be in Invisalign. But we have clear plastic trays these kids can wear to straighten their teeth as well. Again, all customized, no goop, none of that stuff. It's all done with digital impressions and scans with the iTero scanner. They get these clear plastic trays they can wear. For parents that are concerned or maybe want to try it out, Dr. Barrick came up with this ingenious program called Try a Tray, which we are, really proud about, especially with children on the spectrum. They can give this stuff a shot and see how it works for them. Got those feedback from Scott over there.
Sorry.
But yeah, besides that too, that's just from the orthodontic standpoint. From the pediatric standpoint, we've had an amazing response, especially from children on the spectrum. We've had children that, I was just describing earlier to Allison when we were before this meeting about just what we've seen in the first 2 months. I'll talk about first, we had one mother who left the car running because she said, there's no way my child's ever lasting the dentist more than 5 minutes. Did a whole exam, start to finish. And it was actually the first time the child was able to brush and floss their teeth by themselves, which was, we were just really proud of that moment. We've also had children that were told they need to be sedated under general anesthesia, not even sleepy juice, but general anesthesia for all their fillings, who were able to complete all their work without any of that, just in the office. So we really pride ourselves on taking time with each child. Every child should be treated the same, but we believe in customizing each visit for every child's individual needs, just so that, they have different preferences, they have different likes and wants, and we need to respect that as a community and approach that for every child and offer that to each child as well. I think, even though I've talked about those amazing dental experiences, I think one of the proudest moments that I've seen this week, we had a child on the spectrum who was not really verbal, nonverbal, and had trouble making friends. And he felt comfortable enough at our practice to go around to the tanks, see the fish, interact with other children, and actually started talking about one of my favorite topics, sneakers. And his mother had never seen him do that before. I just think, with this opportunity, we have a capability as providers to really change the course of how we operate. I think that the Autism Alliance groups and everything else that is around here, Massachusetts, is doing an amazing job bringing families together as a support network. And I think as providers, we need to bring this to the next level as well. We need to take this old cookie cutter method of dentistry and change it and really just evolve to the point where we can customize and make each individual patient's needs and wants the priority, and be able to take that off the parents list. If we can make your life easier by just one thing that you have to think about during your life and during your day, it really makes a big difference. So
I just want to say one thing about what, just some feedback, because you're making me a little, Dr. Fraiser, is that when you say that you want to make us a priority, that is something that special needs parents just don't hear very often. We're always trying to fit into what's available. What can we do? How can we, get through it, without being traumatized. So for you to say those words that you prioritize us, and prioritize our families, I just think that that's really, really powerful. And that's something that isn't heard very often. So thank you.
yeah, I and just to say and to elaborate on that too, dentistry is a field that was always taught to run on times and slots and appointments and everything like that. When we know that a child may need more attention or more time, there is no limit. If they want to come in, there's no set expectation for what the visit has to accomplish. Sure, our end goal is oral health, protecting your children's teeth. But if your first visit just requires you to come and see the practice and see what Dr. Barrick's dream looks like, which is amazing, by the way, that's what we're here for. I mean, there is no set reason or goal for these except to, we use the term desensitization, but in the end, it's not really that. It's about changing the perception of what we can do and what we can offer to children. And I really think that if we can approach it this way, this is something that becomes a model for everyone. I usually start off by saying that I'm not here as an advertisement for bubble dentistry, even though that is where I work, but I like to kind of think of myself more as an advocate for what these children should be experiencing. And just, if I can teach through what we offer, hopefully that can kind of catch on. But, love to treat every child if it's possible. So. Oh, I think you're still on mute, Allison.
Sorry, I said perfect.
No.
So Dr. Fraiser,
Yeah,
I was wondering if
sorry.
you could, walk us through, like, you were saying about the desensitization, like, what are some of the, I don't know, I don't want to call them tricks, but some of the things that you've done to, help children who normally wouldn't be that comfortable, coming into the office to be able to, get their dental work done?
That's a good question. So, Dr. Barrick, myself, and Dr. Ozzie, our pediatric dentist, really work closely together to kind of think about everything that happens at the practice, from when the child sets foot in the door to, when they exit. And we think about everything in terms of how can we make this visit more comfortable for children. So, when you text us and you email us or call us and say, hey, I'm interested in setting up an appointment, we have a very detailed questionnaire, like I said, that, you can write us an essay, everything we need to know about your child before you arrive. A lot of that was derived from some of the templates from Autism Speaks, but we decided to go a little bit more in depth and just kind of really open it up and have an open forum for the medical history form, because like I said, not every child has the same wants and needs. Our front desk staff is trained to really work and go the next mile. They're amazing. They'll ask you everything that even if you didn't think about it, they may know something else that you may want or need. And they pride themselves on really kind of just showing that care and attention that, you know, not everyone expects from, you know, the dentist or the orthodontist or anything else like that. In terms of, you know, desensitization, we really kind of work with the children about what to expect. A lot of it is fear of the unknown or fear of previous experiences. And we're really here to rewrite that whole game. We can send you a walkthrough video, which we have one version of it, which we posted on Facebook. You guys have been, you know, amazing to show that to the community. We have another version of the video being filmed this weekend, which is going to be awesome. I'm really excited about that. I won't say any spoilers, but that's coming soon. And we can send that ahead of time to children just so they can be comfortable knowing what they're walking into, what they're going to experience, what they're going to see. Like I said, we have a lot of customizations for each visit. So, you know, if a child has certain preferences in terms of like, well, they like the comfort of weighted blanket, or they don't like, they're sensitive to sound or light, we have everything to kind of work with that, with the sunglasses, with noise canceling headphones, privatized quiet rooms, push toys, anything they may require. In terms of desensitization, in terms of what actually happens at the visit, myself and Dr. Ozzie have really been sensitive to that subject as well. And just speaking with the children, speaking with the parents, how we approach things, how we trained our staff to work with children on the spectrum. We thought of every detail in terms of, you know, how they address them, how we approach certain topics. We have the printed lists of what they can actually see ahead of time, what they're going to experience, what they're going to see, reaction to stimuli, understanding of it. Let's take something as simple as the little rotary cup that cleans their teeth, you know what I mean? That can be terrifying to some children if they don't understand what the stimuli is or what it does or how it sounds. Our staff are amazing. I can mention two specifically, Liz and Christine, who I've watched them interact. I mean, they've even taken some of my expectations and gone just through the roof in terms of, you know, they'll sit there with the children, they'll say, oh, they'll use a name for it, they'll show them the toy, whatever it is. They've even let the children put their finger to it and just, you know, it's a rubber cup, and experience the stimuli and get the sense of what's happening. So there's no shock. There's no, you know, there's nothing that we do at the visit that the child hasn't already seen or heard about or experienced almost virtually. So by doing this, understanding their wants and needs, and just seeing how visits are going, and then, you know, making those decisions, I think we've made some positive memories already, you know. Children that weren't able to have cleanings are having cleanings now. They're taking x-rays. We've even had some children helping us take x-rays, which that never happens. I've never seen children holding them and be like, no, you can do this, and then moving their lips and stuff like that. It's really just evolving to the point where it's becoming more of a, you know, we know what services we have to offer and how we need to help, but having the children be part of that and understanding that, you know, this was created for them. And the more they get involved, the better it's going to be. So yeah, I mean, I did want to say tonight too as well, that if anyone does have any questions, they feel free to ask at any point. This is really just to kind of help people with questions. You know, if anyone is thinking about the process of dentistry, orthodontics, you know, how they're approaching it for their family, their child, or someone they know. I mean, I'm always here to help. And I didn't want to come at you guys with some sort of PowerPoint or anything crazy like that, because I really just want to sit here and really help as best I can. So
one of the questions that comes to us at the office a lot when people call, they're looking for a doctor, you know, eye doctor, dentist, anything, is insurance based. And so are there specific insurances that your office, you know, or do you take insurance at your office?
Yeah, so that's insurances is always the trickiest thing. So we take all insurances, and we're really here to work with you. We've got an amazing office manager / financial expert. Her name's Vanessa, and there's no one better. She'll work with you guys about, maximizing the insurance to the best of her abilities, as well as come up with payment plans and stuff like that to really just help out individual families' needs. If there's something she can't do or doesn't know, she's going to look it up for you, and she's going to make sure she knows it. She's just that type of person. And I mean, she's a great advocate for the community, and she's also one of the people that sets up the appointments and just really goes into depth with questions about each child and what they need. So yeah, she's always there to help work with you. I stopped doing the numbers a long time ago. Her math is much better than mine. So
Yeah, so that's just to make sure for when people call. So it's all the insurances. Is Mass Health included with that, or is it the private insurances?
So Mass Health is a completely separate topic. I can rail about that all night, but I don't want to do that. I'm focused on the kids. Mass Health is a tricky subject. It does limit providers' care. And almost, I know, at least speaking for orthodontically, it kind of dictates how we treat. And I really don't think that's fair for children to be pushed into one sector of treatment just because Mass Health dictates that. And I don't think you're going to get the best outcome for the child through that program. We're always here to help out, see all the children, give you indications for treatment, at least evaluations. We can always talk to you about your insurance plans, what they do cover, what they don't cover, how to work with you to best treat your child. So.
Awesome. Thank you.
Thanks.
Yeah.
That's a great question.
Yeah.
So Dr. Fraiser, I know you said that the parents have come in. Have you with any specialists that have come in with the children thus far, like an ABA therapist or anybody? Have they come in with the children, or has it been predominantly the parent?
It's been predominantly parents so far. I know we do have one coming in the horizon. I got a little note about that as well. But usually at this point, we've seen mostly parents coming in with their children. But we have seen quite a few patients on the spectrum. Especially when our pediatric dentist is there, I would say we're seeing at least one a day so far, which is, it's a lot. And we've seen quite a few in a few days, and it's been amazing. Just seeing how we can impact this community, the stories we hear from the parents, the praise they give our pediatric dentist, and to a lesser extent me, but just how they talk about everything. It's amazing.
That's wonderful.
Yeah.
I find that that's been in my experiences over the last couple decades, is that I think when a parent finds something that works, they find a physician, they find a dentist, they find something that is open and wonderful and caring as you are, it spreads like wildfire. Like, just everybody will hear about it. And that's what you'll start to see that probably exponentially over the next several
well, these groups have been amazing, especially, I mean, just we've had referrals that I think Allison have even mentioned you by name. We've had a lot of people come in and just, they say, I heard about this, I wanted my child to experience it, and they keep spreading it, and it's great. I mean, like you'd said, a lot in dentistry hasn't changed in forever, and I think Dr. Barrick's vision was to create this whole brand new experience for children that they've never heard of, so that we heard horror stories about children have had to be held down, how they were disrespected at other offices because they didn't fit into that cookie cutter template. It wasn't something their staff was trained for or expected, and it wasn't something that they're interested in treating. And when you approach a subject like that and you stay in that field forever, it doesn't evolve. You're going to keep treating children with, for lack of a term, disrespect. And if we can just push that aside and start to think that, if we can give children on the spectrum an amazing experience, then every child will have an amazing experience, and you have to prepare for that too. So it's about customizing it. It's about creating that, I want to say, memory, so that it's something that they don't really, they never, they want to go to the dentist or the orthodontist. And it's actually an issue we're having now. Kids don't want to leave. They get stuck at the iPad station playing games. We got a bottleneck in the front because kids want to see the light up purple jellyfish we got. They're real too, by the way. It's crazy. So it's like, hey guys, we got to let some other people through, but it's crazy. It's a lot of fun.
Awesome. No, I couldn't agree with you more as far as the positive memories, 150%, because dental care and dental health is lifelong. So that to me is the crust of what we're talking about, right? These are skills, these are ways that children can develop into having healthy dental care and life throughout their lifespan. And it's critical and really something that's, again, I've felt very compassionate about my whole life, my child. So it's really great. Any questions? Does anybody have any questions or comments at all?
One other thing that I was thinking of when Allison said about the lifespan is what age does your practice go up to? I know you said it's
That's
a
a great
pediatric
question.
dentist. Yeah.
So that's another thing I think needs to evolve too. The term pediatrics. So, I mean, it's as long as the child feels comfortable with us. If they'd like to go to the adult practice, I mean, Dr. Barrick's probably the best dentist in the state, if not the Northeast Seaboard. So, I mean, it's whatever they feel comfortable with. If they prefer the calming environment of the children's practice, that's fine. But we treat teens, young adults, because that's the environment they're comfortable in. And, that's, again, that term, that random age cutoff has to evolve as well. It's more about what the child and or young adult or teen or whatever they feel comfortable in. Sometimes those needs evolve past the realm of pediatric dentistry or orthodontics into more, general dentistry or prosthodontists. And we have that entire team for that too. I think at Bubble, we also pride ourselves on just being kind of a one-stop shop for the children as well. We've got a pediatric dentist on staff, got the orthodontist as well, but then we've got Newton Dental Associates, Dr. Barrick's practice next door. So we have everything we need with our endodontist, oral surgeons, 3D x-rays, everything. So we really just want to take that need to see, go everywhere, see a bunch of specialists out and just have one home, one dental home for these children.
That's great.
I know I didn't want to take everyone's time tonight too, so we have to go too long. It is a
Good
late one,
listening
I know.
group, but I think this is great because you've given us a real, overview of, what the practice can do. And, I think families and,
I mean,
will be interested to see this and hear this, more than, even the ones who are here tonight, to be able to do that, to be able to.
I mean, we're really here to help.
Mhm.
We're here to open some doors that I think people didn't even think were possible. If it's just a simple cleaning, fillings, anything like that, that's fine. But I mean, some parents didn't even know orthodontics was possible for their child. We've had some say, I can't, Invisalign, what? We didn't even think we can get a cleaning done. So to open this and just to say, we have the option of taking care of your child's oral health, teaching them how to take care of themselves as well with some monitoring or not, or even trying Invisalign or something in like braces. I mean, it's eye-opening to some parents. And it's just, like I said, if we can get the basics down when they're younger, or even just for some visits of just training, working through a desensitization based on the child's needs, we can really open doors in terms of what's possible.
Absolutely. Well, if we don't have any questions, I would like to thank you, Dr. Fraiser, for talking with us tonight and sharing some incredible insights. I'm really looking forward to the future, looking forward to future stories from you and the evolution of this, because I do think it's very transformative, not only for our community, but I'm hoping the larger, dental field, because what you're doing is really spectacular. So thank you very, very much for being.
I appreciate that.
That.
I look forward to working with you guys in the future too. And anything you guys need help, if parents need individual care or comments or questions, they can always call Bubble. I'm available there Monday through Friday. So
thank you very, very much. Really appreciate it.
Thank you so much.
Thanks everybody for coming. Awesome.